Balanced Living Chiropractic. From the helpful staff to the quiet office setting, Dr. Perrin strives to make your visit a pleasant and productive treatment. Using the latest techniques and equipment, your treatment consists of many steps of analysis and correction. Here's Dr. Perrin to explain his balanced approach to healing.
With upper cervical, we have two main goals. Number one, we want to determine how your nervous system is functioning. The nerves control and coordinate all function of your body, and if your nervous system isn't functioning at 100%, you can't expect to experience 100% health. The second aspect that we're looking at is your posture. So is your body balanced? So we measure your head tilt, if one shoulder is low, if that's caused one of your hips to raise up, and in turn cause one of your legs to be shorter. If we find this, what happens is that you're carrying more weight on one side of your body than the other, stressing and straining one side of your body more, which causes an overall postural change. So how does this all come about? The upper cervical spine is composed of two segments. The top one is called your atlas, and they call it atlas because in Greek mythology, Atlas holds up the world. Well, in your spine, your atlas holds up your world, which is your head. The second one is called the axis. Now they call this one axis because of this little bump right here, which the atlas fits in front of and pivots around. The great thing about atlas and axis is that we get a tremendous amount of range of motion. So we can tilt our head to the side, we can check our blind spots, which is really important for function. The problem lies in you have a 10 to 14 pound head that sits on top of a 2-ounce bone, and the only thing that holds it in place is muscles and ligaments. With the rest of the spine, the other segments have interlocking joints which prevent a large range of motion. They each contribute a little bit to the global motion of the spine, but none of them have the ability to rotate as much as those top two bones in the neck. Now, if you compound that with the fact that your brainstem and upper spinal cord pass right through the top here, this is an area of severe neurological compromise. With the nervous system, it works from top down, inside and out. So the closer to the brain you get, the more neurological function can be compromised. And these are the top two structures in the neck. So if you're out of alignment here, it can affect everything down and out. We're going to take a look over here at the x-rays and just show you how we determine if you do have a misalignment. So first, we're going to look here, and we're looking at your neck from the side to see the overall alignment of your spine. After that, we utilize these two views to specifically calculate how your head and neck have moved. So if we look at the white dashed line here, this represents a true vertical line drawn from the base of your neck straight up. Ideally, we'd like to see the solid line superimposed over the dashed line. So what we see here is that the lower neck in this case has shifted off to the left, the head has shifted off to the left, and this person is now not carrying their weight and their head evenly over their spine. After the first adjustment, we take a post x-ray to determine if we've made the correction that we needed to. And you can see here how much closer this person's neck and head are to that dashed line. Now they're carrying their weight more evenly and they're more vertical over their spine. So what's different about this? Traditionally, with most healthcare professions, they're designed at finding a symptom and treating the symptom. With upper cervical healthcare, our goal is to find the cause of the problem, take care of the cause so that the symptoms can naturally go away. There are so many things out there right now that can treat symptoms. If you have muscle pain, you can get a muscle relaxer. If you have pain anywhere else in your body, you can get a pain reliever. There is something for every symptom, but if we're never taking care of the cause of the problem, the symptoms will always come back. With upper cervical healthcare, our goal is to take care of the cause so the symptoms will naturally go away.